Good morning, good afternoon, and good evening from wherever you are watching us from. You are welcome to this presentation and welcome to Guardian Stars. My name is Murundano Maybe, and I'm going to be your presenter throughout this presentation. Okay, I'm here to discuss how we can manage a patient with depression, and I'll focus on the nursing management of the depressed, on the nursing management alone. Okay. But before I discuss the nursing management, I want to believe that you know the definition of depression and you know how to come up with the diagnosis of depression. Okay, this is the diagnostic criteria of depression. Please, if you do not know this, you have to go through your notes once more and just take a look at how you can make a diagnosis of depression. I want to remind you that it's not all forms of depression that may require hospitalization, and it's not all forms of depression that we can classify as mental illnesses. Okay, so it's important that you know how to make a diagnosis, especially of what we call uh, major depression (MDD). Okay, um, and I want to believe you know the clinical features of depression as well, or the signs and symptoms of depression. Okay, and the other thing that you really have to look at are the types of depression or the classifications, but I want you to look at the types of depression. There are different types of depression, of course. I want you to look at those as well as you study your notes. Okay, so the other important thing that you need to focus on is the medical management of a patient with depression. Okay, what type of medical management can you give to this patient who is suffering from depression? Um, I'll add a link under this video. I'll add a link where you can get the notes on depression. Okay, without wasting much of your time, this is a summary of a very long lecture, but I wanted to summarize it within 10 to 15 minutes. Okay, so let's go straight into the nursing care of a patient who has depression. Okay, so this nursing care, I've divided it into two parts. The first part is the general nursing care. The second part is the specific nursing care. What do we find under the general nursing care? The general nursing care is composed of the following information. Okay, this is the type of care that you can provide to all types of patients who have a mental illness. It doesn't matter what type of mental illness, but all forms of mental illnesses. So, in case you are a student and you are writing essays, when we talk about the general nursing care, it's a type of nursing care that you can copy and paste across all forms of conditions. Okay, when you're managing patients with all forms of uh, psychiatric conditions. Okay, this is the general nursing care. The specific nursing care is the type of care that is specific to the condition that the patient is suffering from. Okay, if we say depression, you simply look at the problems that the patient who's depressed will be facing, then you put in nursing interventions to handle those problems. Okay, that's a specific nursing care. So what should you include under general nursing care? Under general nursing care, the first thing is you can talk about the environment. Okay, in this environment, you need to discuss what you're going to put in place and what type of environment are you going to nurse your patient from. A patient with depression, of course, may not need to be nursed in an isolation room. Okay, may not have to be nursed in an isolation room. They, of course, also have to be nursed in an environment where there are other patients. By so doing, you will be triggering that desire to socialize in this patient who is depressed. We know that the patient who is depressed is usually isolating him or herself. Okay, they have lost interest in social interaction. by nursing this patient in an environment with other patients, you slowly start triggering that desire to socialize with other people. Okay, and this environment, of course, must be safe for the patient as well. Okay, there must be nothing that can injure this patient. Okay. Psychological care is also important. You can also create psychotherapy. When you give psychotherapy to this patient, you help allay the anxiety that this patient may have. Okay, so it's important that you allow the patient to express himself, and you explain, uh, you give your views about their condition, you educate the patient, of course, and just help them allay the anxiety that they may have. Then you also have to establish a nurse-patient therapeutic relationship. This is a very important nursing intervention. It's actually the bedrock or the foundation of all other treatments that you are going to give. Without a properly established nurse-patient therapeutic relationship, the patient may not be able to follow through the treatment that you are giving them. Okay. We know patients with mental illnesses have trust issues. A patient with depression may have trust issues, and you need to gain this trust from this patient. Okay, how can you do that? You need to always introduce yourself to this patient and tell the patient who you are and what you are and what's your interest in this relationship that you're establishing with the patient. And then you should not appear judgmental. You should not make promises that you cannot fulfill, because if you make promises and you don't fulfill them, the patient will lose trust in you. And once the patient loses trust in you as a health personnel, meaning the whole name of the healthcare team has been destroyed. Okay, so you don't want to have a patient who has trust issues in health workers. Okay, so the other point that you can talk about is a group therapy. It's important to involve the patient in group therapy as well. When the patient attends these group therapies, the patient will learn more about the depression and how and how it affects him, and then the patient will also learn how to manage this depression and how to live a normal life with this condition. Okay, and the patient in these group therapies will be motivated and encouraged by other ex-patients. Okay, so these group therapies are very important. You always have to link the patient to these group therapies. Okay, then you can also talk about assertiveness training. It's important to train this patient so that they become assertive. You know, the patient with depression must be able to stand for their rights. They should be able to defend themselves when they are hurt. When you train them to be assertive, you teach them how to express themselves effectively without infringing or hitting the other person. So it's very important, it's very vital that you train this patient to be assertive as well. So you can talk about these 5 points under general nursing care. It's okay, but there are other points that you can also include. Okay, so let's go to specific nursing care.
Welcome back to our presentation and welcome back to Guardian Stars. We are continuing with management of a patient with depression. In the previous presentation, I talked about how we can generally manage a patient with depression. In this presentation now, we are going to look at the specific nursing care of a patient with depression. Alright, so when we talk about specific nursing care, we have to establish the problems that the patient with depression will be experiencing. Then we write down the nursing interventions for those problems. Okay, I'm sure by now we know how to come up with problems for conditions, right? One of the problems that I have identified for this patient is that the patient is at risk for self-directed violence. Okay, this is a patient with depression. Of course, they are at risk for self-directed violence. It could be because of how this patient is feeling and looking at himself, he feels he's a failure, so he might end up trying to commit suicide or just harming himself or ending his life, okay, because of the feelings of worthlessness. So because of this problem, it's a risk. Remember, I have to put in nursing interventions to prevent this patient from being violent to oneself or trying to commit suicide. Okay, so what should I do when you list this as a problem? Risk for self-directed violence. Think of how you can manage a patient who tried to commit suicide or who is at risk of committing suicide. Okay, so how can you do that? You have to make sure that the environment is safe for the patient, of course. Remove all items that may be used as weapons in that environment. You also have to at least make sure you are paying this patient unexpected visits. Okay, you are at least checking on the patient from time to time. This will at least help you to identify any violence on time so that you can protect the patient as well. Then apart from this risk for self-directed violence, of course, under this subheading, there are many more points that you can talk about, or there is a lot that you can talk about. Okay, those are just a few points that I've mentioned because I want this video to be as short as possible. Remember, it's just a summary. Then I have also discovered that my patient has impaired social interaction. Okay, this is a depressed patient. They have impaired social interaction. So what should I do to help this patient begin to interact? I should not nurse this patient in an environment alone. Of course, they have to be nursed in an environment with other patients. Okay, apart from that, I also have to be spending short moments with the patient for me to promote that interaction with the patient. Of course, this is a patient who has depression, and it might be difficult for him because they have low self-esteem. It's going to be difficult for this patient to start interacting with a lot of people at once. They have to begin interacting with me first of all, and that is why in the general nursing management we talked about establishing the nurse-patient therapeutic relationship. That is an ongoing process. As you establish that therapeutic relationship, you are also helping the patient to become interactive. As the patient interacts with you, the nurse, when you see that the patient has started expressing himself and interacting with you, you can bring in another patient. You pair the patient with another client. Okay, you are trying to promote social interaction, so you can pair the patient with another client. You give them games to play. By so doing, the patient will be encouraged to begin to interact with other people. Okay, so on social interaction also, there are a lot of points that you can talk about, or there are a lot of interventions that you can put in place as a nurse. Then chronic low self-esteem. Of course, this patient with depression may have this as a problem as well. How can we help boost up their self-esteem? So first of all, you should be non-judgmental to the patient. Make sure that you do not judge the patient. Okay, and always give feedback to the patient, positive feedback to the patient if they do anything that is acceptable. Okay, do not judge the patient. Praise them and give them positive feedback whenever they do something acceptable. Okay, and then you have to, in the process of you linking up this patient or pairing the patient with another client, this patient will begin to express himself or herself, and by so doing, this patient's self-esteem will begin to improve. Okay, the other thing, in the general nursing care, we talked about assertiveness training. It's also important here under specific nursing care and in boosting self-esteem. When the patient learns how to express himself, his self-esteem is going to increase. Okay, because he knows he can stand up for himself. Okay, there are moments as well in life when you feel good about yourself because you expressed yourself. Okay, most of the time we feel sad because we are not able to express ourselves when things are bad or when someone is infringing our rights. But the moment you express yourself and speak out, you of course get relieved and you feel good about it. Same applies to our patient as well. If we train our patient to be assertive, of course, their self-esteem is going to be improved as well. Self-care deficit. Our patient with depression may have this problem, self-care deficit. So we need to help this patient with care. We know what our patients need. They need a bath, they need hair care, nail care, all those basic needs of the patient. Okay, basic care needs of the patient. If the patient is unable to do these things on their own, we can help them out to do these things. Okay, so as you help the patient with self-care needs, that will also be boosting up their self-esteem as they do certain things on their own, like brushing their mouth, also grooming their own hair, or taking a bath and putting on clean clothes. That will also boost their self-esteem, and that will also be promoting self-care as well. Depending on the extent or the severity of the condition that the patient is suffering from, if the depression is not very severe and the patient can do certain things on their own, of course you can allow them to, you can just give them instructions, give them step-by-step instructions so that they are able to do those things for themselves. That will help this patient's self-esteem to be boosted, and also that will also be promoting self-care. Okay, altered nutritional status. Patients with depression might have problems with eating as well. Some may lose appetite and some may have abnormal appetite. So what you can do for this patient with depression, you need to make sure that you provide them with food depending on the severity of the condition as well. If the patient is severely depressed, you can provide them, make sure you prepare the food for the patient and you make it available for the patient and give them, and instruct the patient to eat. If the patient is not feeding, you can help feed him or her. Okay, that will help the patient feed as well. Then you can also bring in the family members. The family, you may ask the family to bring the patient's favorite food. Family involvement is very important, and that will also boost the patient's self-esteem, and it will also motivate the patient to feed. Apart from that, you can also give the patient some finger foods, of course, that they may be eating as they are seated. There are a lot of points that you can talk about under a specific nursing care. Those few points that I have talked about under nursing care, under specific nursing care, are just here to guide you or give you a picture of what you should talk about under specific nursing care. Okay, thank you so much for being in attendance. I wish you all the best as you study.